Hello, today we are talking about a use case for virtual brain twins in epilepsy for diagnostic purpose. Epilepsy is a chronic brain disorder characterized by recurring unprovoked seizures. In a lifetime, 1% of the population is affected by epilepsy. Among them, around 70% can be controlled by anti-epileptic drugs. The remaining 30% are drug resistant and may be considered for surgery. Only one-third of these patients can benefit from invasive SEEG implantation, where electrodes are implanted in the patient's brain to measure more local and stronger activity inside the 3D brain, sometimes reaching deep structures such as the hippocampus and amygdala. The first clinical trial on the application of virtual brain twins are aimed at estimating the EZ network in epilepsy, called EPINOV. EZ network means the epileptogenic zone network, where seizures are generated. Today, we will walk through one example of estimating the EZ network. This patient is also an example from our Science Translational Medicine paper, published in 2023. A 29-year-old left-handed woman had drug-resistant epilepsy since age 2, with nocturnal focal seizures, with impaired awareness, occurring several times per week. Symptomology pointed to frontal and insular epilepsy. Non-invasive measurements, including scalp EEG and video EEG, showed possible left frontal seizure onset. fMRI confirmed right hemisphere language dominance. 3 Tesla MRI appeared normal, while 7 Tesla MRI showed a possible FCD in the left orbitofrontal cortex. PET demonstrate left temporal and orbitofrontal hypometabolism. All these evidence led to the following clinical questions. Is the left prefrontal cortex involved in the EZ network? Is the insula involved? And what is the role of the temporal lobe? Based on all these clinical questions, 12 electrodes were implanted in the left hemisphere, covering the frontal, insular, temporal lobes, and 2 were implanted in the right. This is one typical seizure out of the 4 recorded from SEEG recordings. The right figure shows the energy distribution across the different electrodes. The reddish ones are stronger. In Marseille, we have the typical clinical quantification of the EZ network from SEEG data, including spike rates calculated from interictal recordings recorded between seizures. The epileptogenicity index EI and connectivity EI index are calculated from ictal recordings during seizures. All these lead to the clinical hypothesis for this patient: left insula gyrus brevis and left orbitofrontal cortex. The first surgery was based on the clinical hypothesis, and 3 brain regions were removed, highlighted in blue here. Unfortunately, seizure relapsed 1 month after surgery. With nocturnal seizures presenting the same symptomology. The inputs for virtual brain twins, T1 MRI and diffusion MRI, to obtain the structural connectivity among different brain regions. CT scan, co-registered with T1 MRI to map brain region and electrode locations, and SEEG recordings to extract functional seizure patterns. All these are important input for virtual brain twins. Through a Bayesian inference algorithm work on the models, we obtained the clinical report for this patient. On the right are the key outcomes for the clinical report in EPINOV. Let's zoom in. We obtained the highest epileptogenicity values in 3 regions. 2 yellow ones are consistent with the clinical hypothesis. The red one, the left inferior frontal sulcus, was identified by the virtual brain twin, but not by the clinical hypothesis. Based on the clinical report from a virtual brain twin, our clinicians also found confirming evidence from MEG after the first surgery, and the patient underwent a second surgery. The patient was seizure-free for 9 months, with a seizure reduction rate of 98% at 2.5 years follow-up. The first virtual brain twin clinical trial, called EPINOV, involved 13 French centers and include 356 patients. The clinical coordinator is Professor Fabrice Bartholomé. Today, we worked through one example of estimating the EZ network, which benefits the diagnosis of the most complicated cases, representing 1 in 9 patients. Looking ahead, we believe that, together with scientists around the world, virtual brain twins can improve intervention planning, such as enabling less invasive surgery procedures, better stimulation strategies, and better medication selection for benefiting most patients. Thank you. Thank you.